You've tested positive for HIV, which is the virus that causes AIDS.
The human immunodeficiency virus, or HIV, attacks the body's immune system. If left untreated, the disease progresses to its most severe stage, AIDS. HIV is an enveloped virus containing two identical strands of positive sense linear RNA, along with several enzymes. Transmission can occur following exposure to infected blood and other bodily fluids. Once inside a person's body, the HIV virus infects specific cells in the immune system, called CD4 T cells, which is then forced to produce many new copies of HIV.
Mr. Woodruff, have you ever used intravenous drugs? Have you ever engaged in homosexual conduct?
Homo. You say homo?
Yeah.
That's what she said, didn't you? I ain't no faggot, motherfucker.
Mr. Woodruff.
Alright, it's a fucking Fauci. Call me a motherfucking faggot. I'll whip your fucking ass, boy. You speak fucking English, motherfucker.
Based on your health, based on your condition, based on all the evidence we have, we estimate you have 30 days left to put your affairs in order.
But what if everything that we think we know about AIDS actually isn't true? There's an organization called Rethinking AIDS, and they say that there are over 2,000 scientists as questioning the very theory that HIV causes AIDS.
Because when you're dealing with a new syndrome like that and you don't really understand it, anyone's hypothesis about what this might be is held in equal respect to a well-thought-out hypothesis.
Yes, science!
Don't forget to smash that subscribe button.
Science in this country and science in the world used to be democratic. All voices could be heard to find the truth. In particular, if we don't have the truth, if a hypothesis is as totally bankrupt as the virus hypothesis that hasn't saved one single life, we are killing 180,000 people with ACT.
No, for people who don't understand, your argument, I mean, in a paraphrasing sort of way, is that it's illicit drug use. It's like amyl nitrate and crystal meth, and that is what's destroying the immune systems of these people. And then HIV shows up because their immune system is diminished. Is that a fair assessment of it?
So HIV is a virus.
It's a virus. It's one of the most harmless type of viruses we know. That's why we only discovered them really well worked in them in the last 20, 30 years.
So how could it be possible that no one else believes this, that the scientific community sort of looks down on your assessment of this? And
so in spite of your brilliance, they make you look incompetent, thus the mysterious lost file? Is that what you're trying to tell me?
Correct. I was sabotaged.
As we mentioned in our conversation with Bill Gates, a Kaiser Family Foundation survey found that more than half of unvaccinated Americans think the vaccine is more dangerous than COVID.
It's an unproven vaccine. It's just being accelerated and eliminated virtually every safety study.
He is the ultimate super spreader, not of the coronavirus, experts say, but of misinformation about COVID-19. His name is Dr. Joseph Mercola. That's exactly why the Center for Countering Digital Hate, a nonprofit tracking misinformation about COVID online, put Dr. Mercola, an osteopathic physician, at the top of its disinformation dozen. A list of 12 people, the group says, were the source for sharing 65% of all anti-vaccine messaging on Facebook and Twitter.
And so I think we have to stop coddling people when it comes to this and the vaccine, saying, oh, you can't shame them, you can't call them stupid, you can't call them silly. Yes, they are. The people who are not getting vaccines, who are believing the lies on the internet instead of science.
Yes, science!
Don't forget to smash that subscribe button and follow me on Patreon.
It's time to start shaming them. What else? Or leave them behind.
Are you trying to get logged on to a computer, or so you do not work here anymore? Talked to HR yesterday.
I did not quit, and I was not fired. There are only two options. I have not quit, and I have not received a termination letter.
You're going to have to leave. We need your badge, and we need you to leave.
No.
We're going to ask that you do the right thing, and you leave right now.
No, you guys chose not to do the right thing by not giving us a choice. We did not quit. Okay, so
there was a choice.
Okay, so then fire us. So then fire us.
So I'm the director of security. And under my authority, I need both your ID badges.
I need
right
my
now.
termination letter.
I need your ID badges right now. This doesn't have to go this way. You can cooperate or you cannot.
You don't have any grounds to
I
say
do
that.
have grounds.
No, you don't.
We are paying an army of 50 to 100,000 scientists who cannot even predict the spread of AIDS. That is the time to say, where's our market economy? Does that make sense? Is the patient getting its dollar's worth of treatment? The answer is clearly no.
Yes, science!
Don't forget to smash that subscribe button.
There is no hypothesis in biology that has been so unproductive, so unable to predict anything as the virus AIDS hypothesis. It is time to stand up and to call for alternatives. But it's difficult to do in our country because medical science is now a totalitarian field. It is entirely regulated. The money is entirely distributed from one institution, that's the National Institute of Health.
And then abolishing rights to assembly, and you can go on and on. Basically, the entire retinue of constitutional rights have been trampled in the last year in a way that we couldn't have imagined even 2 years ago. The way that he's managed to do that is Tony Fauci has a $7.6 billion annual budget. $6.1 billion come from United States taxpayers, and then $1.6 billion come from the military. And that's why he got into all of these bioweapons. After 9/11, the military started pouring money into developing bioweapons.
Yes, science!
Don't forget to smash that subscribe button.
First of all, I don't have anthrax. And it's hard for Americans to imagine how evil the people are who are doing this. We're having to adjust our thinking. We're a kind nation, we're a compassionate nation, we're a nation of strong values, and we value life. And we're learning people in this world, want to terrorize our country by trying to take life. They won't succeed. This country is too strong to allow terrorists to affect the lives of our citizens.
And so they called it dual use because it allowed him to say, well, we're going to do this for vaccines, but the real agenda behind it is that it's developing weaponry. And it's never done there's no knowledge that's ever come out of 20 years of him messing with this stuff that has ever helped public health. And we now know that, of course, the virus almost certainly came from experiments that he was funding in China, and he has caused this global pandemic.
Dr. Fauci, do you still support funding of the NIH funding of the lab in Wuhan?
Senator Paul, with all due respect, you are entirely and completely incorrect.
Anyone's hypothesis about what this might be is held in equal respect to a well-thought-out hypothesis.
You don't think inserting a bat virus spike protein that he got from the Wuhan Institute into the SARS virus is gain of function?
Yes, science!
Don't forget to smash that subscribe button.
What vaccines do is they teach your immune system about the pathogen.
Every cell in your body is a tiny factory, constantly making proteins. Your genetic code, or DNA, directs every activity. Protein-making machinery in the cell reads the cell's own DNA and makes sure the cell proteins go where they're needed. Viruses have their own genetic code, but they don't have the machinery to copy their DNA. So viruses need your cell's machinery to reproduce themselves. A virus starts this process by using the keys on its surface to gain entry. Like a Trojan horse, it enters the cell. The virus releases its own DNA into the unsuspecting cell and hijacks the protein-making machinery. Now, this vital cell function becomes an assembly line for new virus particles.
A common technique in genetic engineering is to insert a new gene into a loop of bacterial DNA called a plasmid. The enzyme has a precise shape that allows it to run along the groove of the double helix, scanning in the case of ECOR1 for the base letter sequence GAATTC. The enzyme then cuts the plasmid at this specific point, allowing a new piece of DNA to be inserted. When it cuts, ECOR1 leaves a sticky end. This helps the new gene to attach. The joins are then stitched together by another enzyme called DNA ligase. Very quickly, large numbers of the bacteria can be produced, each with a copy of the inserted gene.
In gene therapy, a functional copy of the gene is delivered into a patient's own cells. Gene therapy uses engineered viruses to deliver genes into cells. These are called viral vectors. Vectors made from adeno-associated virus, or AAV. In gene therapy, the two native AAV genes are removed and replaced with DNA that contains a functional gene with instructions to produce a normal protein. Once administered, AAV vectors enter the patient's cells and deliver a copy of the functional gene directly into the nucleus.
This is the coronavirus, and this shape on its outside is called the spike protein.
In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named COVID-19. The virus causing this disease is known as severe acute respiratory syndrome coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with COVID-19 coughs or exhales.
What's typically done is you just take either a piece of the virus or just the spike, that thing on the surface, and you put it on something else. There's over 100 different efforts making many different types of coronavirus vaccines. One final way that's new.
Senator Paul, with all due respect, you are entirely and completely incorrect.
You don't think inserting a bat virus spike protein that he got from the Wuhan Institute into the SARS virus is gain of function?
Then I heard about the lab. And I was like, wait, if they made that one in the lab, do I really want a little piece of that virus in me? Is it possible there's something in a lab-made virus that is different and would make a vaccine different than the ones we've had for decades, which were made from viruses that occurred in nature?
When I was a kid, the disaster we worried about most was a nuclear war. Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
The adenovirus is one that you have history with, or at least viruses in that family. You are very unlikely to have any evolutionary history with beta coronaviruses, which are the ones that SARS-CoV-2 comes from. So just from the point of view of what unexpected might happen if we give you the adenovirus vaccine, it's much less likely to be dramatic than lipid nanoparticles, which is what the mRNA vaccines are packaged in.
The advantages of the technology stem from the microfluidic chamber, which enables rapid mixing under laminar conditions. As the fluids mix, on first contact, the cationic lipids complex with the negatively charged nucleic acid to form the beginnings of the particle core. The helper lipids aggregate further as they come into contact with the aqueous solution. Finally, the PEG lipids orient themselves on the surface with hydrophobic tails pointing inwards. This process creates uniform particles and is highly reproducible.
But there's a big question lingering over the process. How do we balance safety with speed? Because of the urgency of the pandemic, the White House has launched Operation Warp Speed, which provides funding and other assistance to help companies speed up the development and distribution process. Biotech company Moderna, as well as Pfizer, which partnered with the German biotech company BioNTech, have been working on what's called an mRNA delivery approach to a vaccine. Traditional immunization methods involve injecting a dead dead or weakened form of a virus into the body. This triggers the immune system to create proteins called antibodies, which protect a person in the event a live virus gets into their system. The mRNA vaccine approach doesn't require injecting a virus into the patient in order to create those antibodies. Messenger ribonucleic acid, or mRNA, are molecules that exist within the body that transport instructions to the part of the cell that creates proteins. Once those programmed strands of mRNA are introduced, the body's natural process of creating proteins takes over, and it reproduces the antibodies without needing the weakened virus present in a person's system. This new approach to a vaccine has never been approved by any world regulatory body. There are some advantages to the mRNA approach. Because the vaccine doesn't contain a virus, the participant can't get infected by the vaccine, which is a risk for traditional immunization methods.
On to a medical story that has created some amount of a public health panic in India after traces of a polio virus, a particular strain that is known to have been eradicated from India, were found in some batches of an oral polio vaccine. This was manufactured by a company based in Ghaziabad, Biomed Private Limited. Now, Biomed is a major contributor of a polio vaccine and supplies polio vaccines for the government-run immunization program. So, a probe has now been ordered after this virus was found in the vaccine.
The mRNA vaccine would also be easier to manufacture. Traditional vaccines that use a dead or weakened form of the virus must be grown inside live cells. The most common way for the flu vaccine to be manufactured at scale is to grow the vaccine's viruses within fertilized hen eggs. Those eggs are incubated for several days to allow the viruses to replicate. The viruses are then killed, purified, and go through extensive quality testing before distribution.
As far as the little fragment of DNA in question, or the fragment of RNA, they produce the same proteins. So the target is the same. The virus is wrapped, the SARS-CoV-2 virus is wrapped in spike proteins, and the idea is to give those spike proteins to the immune system so that it recognizes them immediately if you ever get infected. And from that point of view, the vaccines that are currently available are equivalent.
You're not worried if it was made in the lab that it would be different? That a vaccine would be different, made from that came from a lab instead of nature itself?
All of our best tricks we are borrowing from nature. And in this case, we are just simply taking that spike protein and figuring out how to get it into your cells so that your immune system gets a chance to see it.
And we have to stop saying, oh, well, you have to listen to people and, no, you don't. These people are being harmful to the greater good. You don't have to listen to a minority of people who are being harmful to the greater good and who are not acting on logic, reason, and science.
Yes, science!
Don't forget to smash that subscribe button.
We must increase vaccinations among the unvaccinated with new vaccination requirements. This is not about freedom or personal choice. The first part of the plan is to vaccinate the unvaccinated. This is a pandemic of the unvaccinated. We're also going to require nearly all healthcare workers to get vaccinated. And in total, these vaccination requirements will cover 100 million workers. And the vaccine requirements work, and more companies are instituting them. Even at Fox News, they require it.
We're optimistic as to what becomes of it all. It really boils down to our ability to accept. There are no limits.
It figures it would be something like this.
Can work through a whole pandemic with no vaccine. Brave. God will forgive me. Because I'm being forced to do this.
Got the COVID vaccine because she wanted to see life in Canada get back to normal. But the Toronto woman wasn't prepared for what she saw when she looked in the mirror 2 weeks after getting her AstraZeneca shot.
In the morning, I was just looking and I thought, gosh, something is weird with my face. And I thought, whatever, I slept funny, no big deal.
A phone consult with Gibson's doctor confirmed that she had developed Bell's palsy, a form of facial paralysis.
So honestly, when they said Bell's palsy, it's, devastating to look at half your face being paralyzed, but...
Why are we not talking about natural immunities?
It should not be forced upon us to either vaccinate or lose our livelihood.
We do not consent!
Give us our right to say no.
Let's assume that the Chinese were not trying to create a bioweapon. It's possible that they were. If they were, they did a hell of a job because they shut down the world. But let's assume they were just studying this. But it got out. Maybe like on a worker's, it's like when the busboy doesn't wash his hands before he goes to the bathroom and, then you get food poisoning. It raises the question, should we ever be studying viruses in labs this way? If we're just going to create the problem that we're trying to...
Well, that battle was taking place before the COVID-19 epidemic. There were two factions. There was a faction that said we had no choice but to study these viruses and, in fact, to engage in what's called gain-of-function research, where we turbocharge the viruses and make them much more dangerous than they are in the condition we find them. And the argument was that we had to do that in order to know what they would be like in their dangerous form and could perhaps prepare by generating a vaccine. And then there was another faction that said, actually, we're likely to create exactly the disaster we fear. And what was missing from this discussion was a proper evolutionary analysis. Now, the fact is, there are lots of viruses that can escape from nature and infect people, but in general, they don't have a second trick. That is to say, they can infect you, they can make you sick, maybe they can kill you, but they can't jump to the next person. And so what's really conspicuous about this virus is that it had both tricks from the get-go. It infects people and it jumps from one person to the next with no explanation.
Australia has dropped development of a local vaccine candidate after trial participants came back with positive test results for HIV.
Like winning.
And biotech company CSL was still in early stages of testing when developers found it could interfere with HIV diagnosis. They are concerned that if it's rolled out, it could trigger a wave of positive HIV tests.
I get tiger blood, man.
And now it seems to be having a third trick, which is it's mutating, which of course is not new. Viruses are always mutating. That's why flu shots are very often so ineffective, because you're getting the vaccine that's why I never wanted a flu shot, for the one that was around last year. Sometimes they're as little as 10% effective.
As a researcher at the Salk Institute, he pioneered in vitro RNA transfection technology. He subsequently pioneered many new innovations in the fields of RNA vaccination and immunization. We welcome his expertise, Dr. Robert Malone. Let me just go ahead and I'm going to jump ahead and just ask you a question. What are the bioethics of the current campaign to get the vaccine in everyone's arm?
I strongly object to mandatory vaccination. Now, the important thing to understand about all this, I think, for all of us, is there are no perfect vaccines, just like there are no perfect drugs. Government acknowledges that there are risks associated with these vaccines, such as birth defects, cardiac risks, reactivation of latent viruses. We know this as shingles, also Epstein-Barr virus, cytomegalovirus, and other viruses that can be triggered by vaccination, may also be triggered by the infection. So there is a portfolio of risks, only some of which are understood. What we're doing by excessively using vaccine inappropriately for people who don't really need it is that we're driving the virus to be able to escape through evolutionary selection.
To understand how quickly bacteria become resistant to even the most powerful drugs, we visited Harvard University biologist Michael Bain. Bain pours a solution containing ciprofloxacin, or Cipro, a broad-spectrum antibiotic.
This has no antibiotic.
This has no antibiotic.
This one?
This one has just over what the bacteria are able to survive.
It should kill them.
It should kill them.
The next pool?
10 times as much.
Okay.
100 times as much.
Then Bain drops E. coli bacteria at both ends of the table.
There are about 1 million bacteria in there.
Okay.
So the bacteria start at both sides and they race to the center.
Now, we all understand how this works intuitively because most of us are aware that the agricultural practice in feedlots and other places of medicating or chicken houses, of medicating poultry and livestock indiscriminately with antibiotic leads to antibiotic-resistant superbugs that then turn around and attack us.
Chickenizing farms and food, which chronicles the rise of factory farming. We need it to feed the world, she says, but not by feeding low doses of antibiotics to livestock, prevent disease before it happens.
Between 70 and 80% of total antibiotic production is used in agriculture. When bacteria are exposed to low doses of antibiotics, bacteria are stressed but not killed, and the community sends out signals whereby they share resistance genes.
Really?
Actually, low-dose antibiotics over a long period of time are much worse than high-dose. We are coming up against the end of the age of antibiotics.
So the bacteria started both sides and they raced to the center.
In just a few days, some of the E. coli bacteria resist the Cipro and survive a deadly environment.
And if you look right here, they're starting to grow into the center.
Stronger than you would ever give to a patient.
Exactly.
And yet they're beginning to evolve.
Each one of these little things that you see on it, that's a mutant that's developed resistance and started to grow. This is evolution happening.
That means that the E. coli has already outwitted Cipro.
In 12 days.
Which is why the overuse of the drugs is so dangerous. Each time we take an antibiotic, bacteria can develop the same kind of resistance in our bodies.
And now it seems to be having a third trick, which is it's mutating, which of course is not new. Viruses are always mutating. That's why flu shots are very often so ineffective, because you're getting the vaccine that's why I never wanted a flu shot, for the one that was around last year. Sometimes they're as little as 10% effective.
Overuse of vaccines will drive the development of viruses that are able to evade vaccination. The effectiveness of the vaccine is dropping quite rapidly because of the evolution of the virus to escape it. This is one of the lessons coming out of Israel and the UK.
It thought it had vaccinated its way out of the pandemic, but now Israel is in the midst of its fourth wave, with the number of daily new infections steadily rising to more than 6,000 now, a 6-month high.
One more graph and I'll go to your calls. Start the shots. 2.5 weeks later, mass illness and death. Okay, just boom. The lines actually converge. So here's Norway right here. Same damn thing. Take the shots, boom. Nobody's sick, boom, start getting sick. Oh, that's really great. Look at this. This is new daily confirmed COVID-19 cases per million people. Wow, look at Israel. Palestine, only 10% shot up. Israel's 9%. They're 5 times worse. More than 5 times worse. Lebanon, basically, nobody's vaccinated. But that's how it works, see?
The Delta variant is spreading at an alarming rate, so the government launched a booster third jab campaign to those above the age of 60. It's a world first. But why a third jab? Health experts say it has to do with the effectiveness of the vaccine over time.
On a research basis, you see a steep decline along the first 5 months. Starting with the 6th month, it's 6% a month decline. So if you take these two facts, that among the vaccinated earlier, you see more severe cases with less background diseases, although very few of them get to be on respirator, but still they are severe, and you don't see it on those who were vaccinated in the last 4 or 5 months.
High levels of vaccination are associated with escape mutants. Those escape mutants are able to infect even the vaccinated. The vaccinated do shed virus and replicate virus. They still do get disease, although maybe less disease. And in some ways that might be worse, because that means the vaccinated that do have breakthrough infections are walking around feeling relatively healthy and yet producing and shedding just as much virus as the people that have received vaccine. And so we have a word for that. We call it super spreaders.
But, okay, so this one is definitely mutating. We have a lot of them now.
Yep.
The South African one, the British one, they're all over the world now. I heard at the beginning of this that they usually get milder viruses as they mutate because they want to survive. They don't want to kill anybody, then they got no host.
You might
right?
expect that a virus that did emerge from a lab that was doing gain-of-function research would precisely not do the thing that wild-type viruses would do, that it might exactly do what we seem to be seeing, get more virulent, get more pathogenic.
You think it's getting more virulent, the mutations?
If you think about it, the expectation amongst those who have been seriously investigating the question of whether this is a gain-of-function lab escape virus is that the virus would have been passed through either animals in the lab or tissues in the lab in order to use evolution to re-rig it. And that means that effectively tension was put on the virus, pulling in the direction of certain things. Some of those things were intentional, like infectivity of human cells, which may have given it extra capacities like this furin cleavage site that no other virus like this has, but SARS-CoV-2 does. So in any case, in an attempt to give it these extra capacities, lots of things will have been inflicted on the virus, including things that we don't think about. So many of the characteristics, the fact that this virus attacks so many different tissues in the body does not seem natural. The fact that it does not, at least at the beginning, did not seem to transmit outdoors nearly at all is very conspicuous. I mean, after all, most animals live outdoors. So a virus that seems to be adapted to indoor transmission is a bit conspicuous in this case. But I think Heather's point is, all right, you take the tension off of it, you let it go into the human population, it spreads out, we've now got many millions of individuals with infections, it's now going to move in the direction that makes the most sense for it rather than the most sense for the researchers. So yes, I think there's every possibility that what we are seeing is a response to this virus now being free to explore evolutionary space.
And the common theme is we need an evolutionary perspective on the research that's being done. It seems that there are certainly perverse incentives to, once you start doing research, to try to keep doing that research regardless of whether or not it's still good for humanity.
So we should have been paying attention to the lab theory at the beginning, but we didn't because it was politicized, really is the moral there.
The first part of the plan is to vaccinate the unvaccinated. This is a pandemic of the unvaccinated. We're also going to require nearly all healthcare workers to get vaccinated.
Can flatten the curve, which is a term that you've been hearing a lot, not overwhelm our healthcare systems.
That's a surge of cases, so you need to stretch it out.
Self-quarantine for 14 days.
Stay at home as much as possible.
Stay home.
Stay home.
People should not be walking around with masks. The fundamentals are not rocket science. It's universal wearing of masks. Masks are very important.
For me, it's easy because I have a lot of masks.
This is okay. Just try to focus on the positive.
Wear a mask.
Wear a mask all the time. And if you don't, you are a selfish ass.
You put another layer on, it just makes common sense.
2 masks are indeed better than 1. Double masking, as it's called.
A 3-layer mask could block up to 90%.
The thing that'll get us back is the vaccine.
No miracle is coming.
We have delivered a safe and effective vaccine in just 9 months.
We have to do a double dose, right?
You have had your second vaccine shot.
If we do our part, by July the 4th, there's a good chance you will be able to get together in your backyard and have a cookout and a barbecue and celebrate Independence Day.
Mr. Woodruff.
Can you give me ACT? The next industries, they just released it for testing. Oh, I want to buy some.
That isn't how it works. For about a year, a group of patients gets either the drug or placebo. It's totally left up to chance. Not even doctors are allowed to know.
So you can die in people's sugar pills?
It's the only way to know if a drug works.
Can you get some for me? I got cash.
I hear you. Unfortunately, no. But when the drug is proven to work, and if you fit the profile, then yes.
She's telling me I'm as good as a horse. You just hold for dog food, huh?
The question of AZT. Now, AZT is what they gave them initially. That was what they gave them when they first started.
87.
Now, AZT, correct me if I'm wrong, was a cancer medication that was deemed to be too dangerous. They used it for chemotherapy, and they stopped using it because it was killing people, quicker than the cancer.
They still use it somewhat also for chemotherapy. It's not different from any other chemotherapy.
But it's a very, very brutal one.
They're all brutal.
They're all brutal.
They're designed to be brutal. They're designed to kill human cells. Chemotherapy, cancer drugs are designed to kill human cells. And that's what they give them. They give them less and less, so they die.
Well, AZT.
Cocaine, alcohol, methamphetamine, AZT. I call a recipe for disaster. Like winning. Now, these drugs you're doing, they're breaking down your immune system, making you susceptible to infection.
Tell me about the last time you took drugs.
The last time I took drugs, I probably took more than anybody could survive.
What are we talking about? How much?
I don't know, man. I was banging 7-gram rocks and finishing them because that's how I roll. I have one speed. I have one gear. Go.
How do you survive that?
Because I'm me. Because I'm me. I'm different. I just have a different constitution. I have a different brain. I have a different heart. I have a different, I get tiger blood, man.
ACT's what's happening.
The only people AZT helps are the people who sell it. Kills every cell it comes in contact with. I'm going to prescribe a regimen of vitamins, as well as mineral zinc, to build up your immune system. Sound fun?
Closing moment in my mind.
It's horrible. It's horrible. Because the first thing you think about is like, how did it happen? Where did it happen? And you start going back through your mind, like, who was involved? What was the thing? And most people that are positive can't they can't pinpoint that exact moment. They can't do it. And I'm one of them. Man, I was banging 7-gram rocks and finishing them because that's how I roll. I have one speed, I have one gear. Go. You know, I thought I was dying when I went to the hospital, you know, and I looked over at Mom and she was like, you've gotten through harder times. I'm like, are you sure? So, like, winning.
I feel like we're in Sodom and Gomorrah right now. It's just sex, drugs, killing, whoever, made the best girl or guy stand up, like it's, come on. I feel like I'm in a gladiator movie right now.
I'm 54 now. So I tested HIV positive. I'm a carrier. I'm losing weight. A HIV carrier has to eat twice as much as a person that's healthy to keep our immune system up and fighting. A lot of people don't tell you that. We can beat this COVID-19. We can beat HIV.
Okay. About 1.1 million people were living with HIV at the end of 2010. About 16% of those people didn't know they had it.
Right.
1 in 5 are unaware of their infection. Men who have sex with men account for most new and existing HIV infections among men. Black men have the highest rates of new HIV infections among all men.
Right. So I know those numbers are still devastating. We have a fear of going to the doctor. Or we have a fear of needles, like me. I don't like needles, man. I be looking away when the doctor I can't even look at a needle. I might faint.
But they kill the liver and they screw up your metabolism.
I see.
They are not quite as toxic directly as ACT or the DNA chain terminators.
Okay.
But now all of the antiviral treatments are cocktails of DNA chain terminators and protease inhibitors. So you get it many ways.
So, doctor, if somebody had HIV...
And guess what the people who take those eventually die from? And it's not so rare. They die 10, 20 years later. The dose is so that they won't die immediately. I think that would be bad even for the pharma companies.
Sure. But isn't that better than, isn't dying 20 years later better than dying 6 months later as HIV did?
That would be better, but was not HIV. There are millions with HIV who have nothing. They're exploding in Africa, the population. There are 1 million Americans, they're still around. 500,000 Europeans, still around. It's what they usually die from, these guys, long-term treatment.
Toxicity, probably, right?
Well, they die from pneumonia, from lung disease, kidney disease, and heart disease. And then they get dementia, they get a chemo brain. If you have these chain terminators working in your mitochondria, you become more and more senile very early.
Step over by your vehicle. But you're saying protease inhibitors actually are toxic and very bad for the body.
And they take the cocktails, usually.
Right.
The typical recipient takes 2 chain terminators and protease inhibitors.
Right. So how are they getting better?
They don't get better. Where's the evidence that they get better? They acknowledge that they never cured anybody with these drugs. Never any cure.
Ago, the FDA advisory panel voting not to recommend booster shots of the Pfizer COVID vaccine for people 16 and older.
Hi, Martha. Well, clearly the committee were extremely frustrated with the insufficient data. This is not
that there were some concerns about inflammation of the heart and whether or not the benefit of receiving the vaccine outweighed the risk of that.
So kids are at higher risk of heart inflammation, myocarditis and pericarditis. Their immune response and inflammatory response is just a lot stronger.
That's where boosters come in. The shots that give you even more protection than after your second shot.
A panel of 18 medical experts, an FDA advisory panel, met today for hours to consider whether to recommend a third Pfizer shot for everybody who's already had the first 2 shots, everybody who's already been fully vaccinated against COVID. If you tuned into the live stream of this meeting today, it was sort of exactly what you'd expect a scientific meeting to look like. Lots of charts and slides and bullet-pointed lists. Should everybody over 16 get a booster shot? The answer in the end was no.
Of course, I had to step away, but my sense is that they're going to talk next about narrowing that down to seniors, maybe 65 and older, these people who are at the highest risk of severe illness and death. And it seemed like there was appetite among the panelists to accept boosters for that population, while saying that we still need some more data for the younger people.
Hey, Andrew. So this is an agreement to supply 1.7 million courses of this drug, which is called molnupiravir. It's an oral antiviral drug. This deal, which would be worth $1.2 billion, is only, of course, if the drug gets emergency use authorization or approval. Now, this is a pill for COVID that you would take twice a day.
Pfizer announcing it is starting a human clinical trial of a pill for COVID-19. This would be an oral antiviral drug targeting this virus. And it's what's known as a protease inhibitor, which aims to prevent viral replication. And these have been very successful in treating HIV and hepatitis C. And this is the kind of drug that Dr. Fauci has been talking about that we need for SARS-CoV-2. Now,
So protease inhibitors do not work, or they are a fake drug, or
what do they do that's positive that's helping these people improve their health condition?
I don't think anything.
Nothing.
Attachment inhibitors represent a novel class of antiretroviral drug. They prevent the initial interaction between the virus and host cell, blocking subsequent viral entry into the cell. The attachment inhibitor binds to the outer domain of HIV-1 GP120 on the viral envelope, just underneath the region for CD4 binding. As GP120 is not able to bind to the CD4 cell, subsequent viral entry is blocked. In summary, attachment inhibitors prevent the first step of viral cell entry, attachment to the CD4 cell membrane.
Cocaine, alcohol, methamphetamine, AZT. What I call a recipe for disaster. Such a shithole. Now these drugs you're doing, they're breaking down your immune system, making you susceptible to infection. You're saying cocaine scaring you numb? No, I'm saying cocaine made you more susceptible, as did the AZT. AZT's what's happening. The only people AZT helps are the people who sell it. Kills every cell that comes in contact with it.
If you have these chain terminators working in your mitochondria, you become more and more senile very early. It is described now in the San Francisco Chronicle just a week ago. They have this AIDS Institute there. They, for the first time, let it so. Maybe it's the drugs too.
There's a disconnect, right? There's something wrong. If they were dying by the droves and all of a sudden they got on these protease inhibitors and the whole community became healthy. So you're saying it was like a placebo effect for the entire community, or the whole community changed its approach to life? Is that what happened?
The drug use, the recreational drug use, went down somewhat. I don't know where it's now, but it was word of mouth that this was probably part of the problem. I mean, Michael Callan, these guys write it themselves. They say this lifestyle is untenable.
It's unquestionable. I mean, there's no question that it is a part of the problem. Everybody who does like hardcore drugs like that, it fucks your body. So what happened to these people? There's got to be an explanation. These people are sick. They take the protease inhibitors. They're healthy. They live. But you're saying protease inhibitors actually are toxic and very bad for the body. Are they getting better?
They don't get better. Where's the evidence that they get better? They acknowledge that they never cured anybody with these drugs. Never any cure.
Where was the eureka moment for you?
Well, as soon as I saw the papers from Gallo published, I knew that was politics, not science.
Well, Gallo was painted as a really nefarious character in a couple of things I've seen.
Pretty good. But I mean, the evidence was already in there. All he found was antibodies, not virus.
Yeah, for you guys, Gallo was the scientist at NIH, correct me if I'm wrong, the scientist at NIH who actually isolated what you would call the AIDS virus.
So anyway, so that virus was not to be found. He had a hell of a time finding it. You may remember the so-called scandal that he didn't find it.
Yeah,
so
he took credit for it when the French actually were the ones that isolated it.
So if you have a virus with a high load and killing people, all you need is pick a needle and you have the virus. Viruses can only hurt you if they are biochemically active, kill their cells and are there in large numbers. When they are latent and neutralized by antibody, no action. Nothing happens biochemically. That was my starting point.
I bet you're surprised to see me. I need to know just exactly what you're pumping in my bloodstream here now.
This is a combination of AZT, and we've also got a full spectrum. Don't.
I'm suing you for attempted murder. I say what goes in my body, not you.
That decision, like it or not, is left up to the people in this hospital.
What you think I'm one of your goddamn guinea pigs, Savard? Huh? I look like a rodent to you.
Mr. Woodruff.
You look, and I watched a lot of people die in the 80s and the 90s in New York. And a number of them were gay, but...
Lots of them were gay. In
yes.
fact, that was the first... But still is the major.
Sure, but here's what was interesting is that most of them were dying from very similar symptoms. If you went there, in fact, the majority of AIDS, and you can correct me when I'm wrong here, but the majority of AIDS patients die of starvation. It's very difficult for them to hold food, to retain food. That was really, when you went to the wards, and I did, you'd see all these AIDS patients and they were terribly skinny. And actually what happened was, yes, the virus would destroy your immune system, and you'd be exposed to, you'd get Kaposi sarcoma, which were the big, these rare skin cancers that only old people get, and all kinds of awful diseases. I mean, I watched people with these terrible rashes, they didn't know that there was clearly in their bloodstream, when you get tested for what they'd call HIV, they're not seeing the virus. What you get tested for and what shows up on your test is antibodies to the virus, right?
A very important point.
Right.
We started off with an antibody test. That's a very sensitive test. It's confirmed by what we call a Western blot test for diagnosis. It's very easy to do. Several generations later, we have tests that can be done literally in minutes. It could be done on saliva. It could be done on blood. But the molecular techniques to probe for the virus, PCR and a variety of other techniques that we now have, are widely used throughout the world, and they're very sensitive and very good tests for the virus.
You know, it's just as opposite as you could get a virus.
Yes.
An antibody against it. That is neutralizing and stopping and killing.
Exactly.
That is a vaccine. That is nature's and mankind's only protection against virus is a vaccine.
Antibodies. A vital weapon of the immune system. Antibodies are designed to fit and attach to specific invading molecules. By attaching to the cell's receptors, the toxin burns through cell after cell, attacking nerves that control breathing, heart rate, or kidney function. When antibodies arrive, everything changes. Instead of attaching to the cell's receptors, the toxin now binds with surrounding antibodies, blocking it from attaching to cells. But diphtheria antitoxin provides only temporary protection because its antibodies will run out. This is called passive immunity. When the immune system makes its own antibodies, it's called active immunity, which is what a vaccine creates. Through a series of steps over many days, the immune system makes the needed antibodies, now forever ready to quickly deploy its weapons and prevent a future attack.
You know, it's just as opposite as you could get a virus.
Yes.
An antibody against it. That is neutralizing and stopping and killing.
Exactly.
That is a vaccine. That is nature's and mankind's only protection against virus is a vaccine.
there are a couple of aspects about HIV that are very unique and extremely frustrating with regard to the fact that you can't, not only can the body not spontaneously eradicate, you can't even eradicate it with drugs, even though you can effectively treat a person to the point of allowing them to lead a relatively normal life by suppressing the replication of the virus. But what the virus has is multiple characteristics. A, it mutates very rapidly. It's an RNA virus. It replicates at an enormous rate, and it mutates. So the body's immune system is constantly trying to catch up with it and essentially never does. It partially suppresses, but certainly never completely, with very few exceptions.
However, though, yes, the body mounts a defense with antibodies. What the theory, and I'll just add to this, what the theory was that what happens is it's such an onslaught on your immune system, the immune system eventually gives up and cannot produce enough antibodies, your immune system gets killed. Along comes David Ho with you, and I know you know the name.
Dr. Ho.
There are a lot of people that took protease inhibitors, and I know them. And by the way, when they were dying, they sold all their stuff because they were going to be gone in a month.
Yeah.
And lo and behold, protease inhibitors keep people alive. I mean, I've seen this.
Mm-hmm.
So the question becomes, if protease inhibitors, which by the way now used to have to take, as you know, a bunch of pills. Now it's down to 4 or 5 pills a day. There are a lot of people living with HIV that the argument goes, and at least from what I've seen, would have been dead and now are living very normal lives. How do you explain that?
First of all, let me say good after late afternoon. Because of the HIV virus that I have attained, I will have to retire from the Lakers today. I just want to make clear, first of all, that I do not have the AIDS disease, because I know a lot of you want to know that, but HIV virus. My wife is fine, she's negative, so no problem with her. I plan on going on, living for a long time, bugging you guys like I've always have.
The people who don't take these talks, the World Health Organization, the Centers for Disease Control say there are 35 million of them at least on this planet. Probably even more. They say 30% of the Africans are positive. In America, we have 1 million. That million in American HIV positives was there in '85, is still here. Why didn't they die out?
Well, they did die, though. A lot of people died
Well,
in the
they say
80s.
we have still 1 million.
Like winning.
When was the last time you used?
I use a blender. I use a vacuum cleaner. I use household items. When was the last time I ingested or took drugs?
Yes. When was the last time you took drugs?
Such an AA stupid expression or term. I don't remember. I do not remember.
A week ago, 2 weeks ago,
Maybe a month
2 days
ago,
ago.
6 weeks. I don't know. It was a couple days before the suits rolled in and said, change everything. We're shutting you down.
Tell me about the last time you took drugs.
The last time I took drugs, I probably took more than anybody could survive.
What are we talking about? How much?
I don't know, man. I was banging 7-gram rocks and finishing them because that's how I roll. I have one speed. I have one gear. Go.
How do you survive that?
Because I'm me. Because I'm me. I'm different. I just have a different constitution. I have a different brain. I have a different heart. I have a different, I get tiger blood, man.
The virus is believed to have originated and mutated from chimpanzees and at some point jumped from an ape to a human in the early 20th century. It's unconfirmed as to exactly how, though National Geographic offers probably because Central African hunters ate infected chimpanzees and other non-human primates.
Today we're visiting one of Asia's most extreme markets. The concept of normal here may be very different from your own.
Where did COVID-19 come from? Many have pointed to a food market in Wuhan, China. These markets sell exotic and wild animals in open-air environments and are particularly popular in China, where the food is seen as cheaper, fresher, and may even contain special healing benefits.
Okay, so when you think about the possibilities of how this virus appeared in the human population explanation, which most public health individuals go by, is that this virus was actually circulating in China, likely in Wuhan, for a month or more before they were clinically recognized at the end of December of 2019. If that were the case,
the virus clearly could have adapted itself to a greater efficiency of transmissibility over that period of time, up to and at the time it was recognized. So Dr. Redfield was mentioning that he was giving an opinion as to a possibility. But again, there are other alternatives, others that most people hold by.
You are the former CDC director, and you were the director at the time this was all happening.
If I was to guess, this virus started transmitting somewhere in September, October in Wuhan.
September, October.
That's my own view. It's an only opinion. I'm allowed to have opinions now. I am of the point of view that I still think the most likely pathogen in Wuhan was from a laboratory, escaped.
And I honestly mean this. I think we owe a great debt of gratitude to science. Science has, in many ways, helped ease the suffering of this pandemic, which was more than likely caused by science.
What do you mean by that? Do you mean there's a chance that this was created in a lab, there's an investigation?
A chance? There's a novel respiratory coronavirus overtaking Wuhan, China. What do? Oh, you know who we could ask? The Wuhan Novel Respiratory Coronavirus Lab. The disease is the same name as the lab.
The sort of skepticism about vaccine safety and the conspiracy theories that vaccines are being used to hurt people as opposed to help them is really quite troubling.
That's just a little too weird, don't you think? And then they ask the scientists, they're like, how did this... So wait a minute, you work at the Wuhan Respiratory Coronavirus Lab. How did this happen? And they're like, a pangolin kissed a turtle.
Yes, Dr. Fauci was emailing with Mark Zuckerberg from Facebook, trying to create that narrative, cherry-picking information so that you would only know what they wanted to know, you to know, and there would be a narrative that would fit with this cherry-picked information.
At this point, it is clear that the trajectory in the U.S. is significantly worse than many other countries, and that our government and this administration have been considerably less effective in handling this. And I personally think we need to take this a lot more seriously. Our response needs to be guided by science.
Yes, science! Don't forget to smash that subscribe button.
So I want to say up front that I'm grateful for the leadership and dedication of Dr. Fauci.
How do you debunk something like that?
Attacks on me, quite frankly, are attacks on science. So if you are trying to, get at me, you're really attacking not only Dr. Anthony Fauci, you're attacking science.
Yes, science! Don't forget to smash that subscribe button.
So the Gates Foundation are looking at these different efforts. It's going to have to go to 7 billion people. And at first glance, this is a bit scary. We go from less than 1 billion in 1800, and then 3, 4, 5, 6, and 7.4 billion where we are today is happening even faster. So Melinda and I wondered whether providing new medicines and keeping children alive, would that create more of a population problem? These vaccines will allow us to save millions of lives. To achieve this goal of global elimination, we need 3 things: the capacity to produce billions of vaccines, the funding to pay for them, and the systems to deliver them everywhere.
It's a protection racket, and that's why everybody's wondering, everybody knew that the coronavirus was lab generated. There was all these Nobel Prize winners and the greatest scientists in the world who were looking at this honestly from the beginning. And there's this furin cleavage, which allowed this spike protein to nestle and to invade the ACE receptors in the human lung. And there's no intermediate evolutionary process by which that could have happened. It had to be inserted. And everybody said that from the beginning, including Tony Fauci's own people. They said this is engineered. And why did everybody for a year keep their mouths shut. The entire virologist community kept their mouths shut, even though they all knew this. The reason was because they know if they speak out, they will never get a dime from Tony Fauci again. And it's not just Fauci. Fauci himself gives away 13 times the amount of money that Bill Gates gives away every year. In the year 2000, Gates called Fauci and asked him to come visit him in Seattle. And the two of them met in Fauci's library. Gates has a $147 million home on the banks of Lake Washington in Seattle.
Built from the ground up to match Gates' exacting requirements, the Gates calls his property, located in the Seattle suburb of Medina, Xanadu 2.0. The completed house extends to 66,000 square feet, giving the property a total floor area around 10% bigger than an American football field. And that's only the main building. As well as having a long stretch of lake shoreline, amongst its main features are a library complete with 2 cartoon-like hidden entrances, a 60-foot swimming pool with indoor and outdoor elements, a tennis court, a trampoline room, and a banquet hall big enough to host 200 guests. That banquet hall can do business and casual, with a 22-foot wide screen for presentations. Naturally, one of Silicon Valley's most successful icons also crams a huge amount of technology into his not-so-humble abode. On arrival, guests are provided with a connection to the house's numerous sensors. This comes in the form of a programmable pin that can be attached to visitors' clothes or function through a mobile phone. As guests move around the vast space, built-in sensors interact with the technology and adjust the house's environment to match preferences. By being linked up to the building, guests can have their choice of music, lighting, and even temperature follow them around the mansion.
And he called Fauci into his library. They sat there on club chairs nuzzling some drinks, and Gates proposed a partnership to him. And the partnership was that they would start a vaccine partnership to essentially take control of this $60 billion industry with no limitation on its exploding growth. And together over the next 20 years, they built this extraordinary infrastructure where they control all of these quasi-agencies that Gates created, Gavi, CEPI, PATH, the Brighton collaboration. They control all of these health ministries around the world who rely on US dollars and WHO dollars for their existence.
15 years ago, you made a big bet with Gavi. How do you think that's paid off?
Well, the work the foundation has done in vaccines through Gavi has been the most important thing we've done. The very creation of the foundation came about because we saw this great inequity, and we gave early grants in vaccines, but then saw there was something missing. And so several people working in global health, including the foundation, decided that starting something to buy vaccines for the world's poorest children was absolutely needed. And in the year 2000, that was announced as Gavi.
This one started with a bat,
a tree, and a boy called Emil.
A life full of wonder.
And a world to be explored. Soon after,
he fell sick. And with our dense cities,
easy travel,
and ecological change, they spread faster
and further
than ever before.
Businesses close and airports shut.
Billions are spent
and loved ones lost.
The sound of a cough
becomes the worst
sound of all.
Let's outsmart epidemics.
Let me ask you both, what is the Gates Foundation doing to fight the coronavirus, and why is it such a priority for you?
Well, our foundation has a big focus on infectious diseases that, kill millions of people, primarily in developing countries. And so, our understanding about how you design a vaccine, we funded lots of new vaccines. We're a partner in Gavi, which actually buys vaccines for developing countries. And we have a lot of the expertise that's not in the private sector to pick which of these we should build factories for and how we coordinate all this activity. Nobody would have predicted that I and Dr. Fauci would be so prominent in, really kind of evil theories about, did we create the pandemic? Are we trying to profit from it? And on and on. And so, I'm very surprised by that. I hope it goes away. I hope this percentage that's really misled by these conspiracy theories, it's unclear to me. There's millions of messages out there, where my name or Dr. Fauci's name is used, but do people really believe that stuff? We're going to have to get educated about this over the next year and understand, how does it change people's behavior? How should we have minimized this, either, working with the social media companies or explaining what we were up to in a better way? From the foundation's point of view, the fact that he took that rescission of the global vaccine money, which, is super, super important. The fact he rejoined the WHO, the fact that he's appointed smart people, the fact that Dr. Fauci will not be suppressed. And they'll take full advantage of Francis Collins and Dr. Fauci, who are wonderful people. In terms of the epidemic, it sometimes felt like they were the only sane people in the U.S. government. So,
Bill Gates, what's your favorite animal? Dog. What's your favorite food? Dog. What do you eat for breakfast? Dog. What is your worst fear?
I don't want my brain to stop working.
Bill is a multi-processor. He'll be reading something else, but then processing at the same time.
It's chaos. If something doesn't line up, he gets really frustrated. It's scary.
But when Bill stills himself, he can pull ideas together that other people can't see.
I could be so extreme. You never understood the first thing about this.
Microsoft hit a new record high on Wall Street.
Rivals paint a dark picture.
Each one of us has to start out with developing his or her own definition of success.
It's chaos.
Whoa. I just got invited to give the commencement address at Harvard this year.
That's amazing.
They know we didn't actually graduate, right?
Oh, that is the best part. They actually give you a degree.
You don't even have to go to class?
No.
And they control, through Gates, they control also Facebook, Apple, Amazon, and Microsoft, and Google. And Google also was part of this deal where they became a vaccine company, and they're creating flu vaccines, COVID vaccines, cancer vaccines. They're all involved with making money, partnerships with the pharmaceutical industry.
The Google News Initiative has launched a multi-million-dollar global fund to fight misinformation about COVID-19 vaccines, dubbed the COVID-19 Vaccine Counter Misinformation Open Fund. Google will fund up to $1 million for each selected project. Priority will be given to collaborative projects of multiple news organizations and projects that
YouTube and its parent company Google have now officially banned dissent. The CEO of YouTube admitted that openly.
But then we also talk about removing information that is problematic. Of course, anything that is medically unsubstantiated. So people saying like, take vitamin C, take turmeric, like those all will cure you. Those are the examples of things that would be a violation of our policy. Anything that would go against World Health Organization recommendations would be a violation of our policy. And so remove is another really important part of our policy.
So you're not just putting the truth next to the lie. You're taking the lie down. That's a pretty aggressive approach.
我注意到，在美国也会有一些网友甚至攻击您，说病毒是从您疫苗的这个研制过程中出来的。您在用什么样的心态面对这种声音？
I'd say it's an ironic if you take somebody who's doing their best to get the world ready and putting, in my case, billions of dollars into these tools. But that, we're in a crazy situation, so there's going to be crazy rumors.
The total economic loss of COVID-19 in terms of GDP and health costs is estimated to be around $16 trillion. Clearly, we need to focus on reopening the economy as soon as possible.
And I'm hearing there's talk about a vaccine passport. What is that?
Yeah, so this is this kind of futuristic idea where we actually have
a requirement to get a certificate of vaccination before we can do things.
What if we were to be required to prove to employers, airlines, or sporting venues that we're immune to the virus?
I think it's a little premature to be thinking and to be talking about how do we get people.
Remember the yellow card immunization forms? In the age of a global pandemic, that could be a smartphone application or a QR code on paper.
And they created this extraordinary infrastructure where they control all the communications, they control the political infrastructure, they control the regulatory infrastructure. And 10 years later, Gates went in front of the United Nations and declared the decade of vaccines. And he gave it $10 billion to the WHO, took control of that agency completely. And the two of them then put together this, they also invested in all these front groups and AstroTurf groups to go after vaccine hesitancy, to abolish vaccine hesitancy. And by 2019, they had their whole infrastructure together. And and that was the year, Adam Schiff comes forward, the WHO at the beginning of the year, in January of that year. In January of that year, the WHO says that vaccine hesitancy is one of the 10 greatest threats to humanity. There's no science behind this. It's just Gates, using them as a sock puppet. 3 months later, Adam Schiff comes out, writes a letter to all of the social media companies saying, we want you to start censoring any information about vaccine hesitancy. In October, Gates has the fifth of a series of simulations, which is called Event 201, but it's one of many. And they bring in military people, CIA intelligence people, pharmaceutical people, the media people from the social media and from the public relations, and they do a drill about how to use a pandemic to impose totalitarian controls, masking, forced lockdowns, how to basically shatter a society. It's all these psychological warfare techniques that were developed by the CIA. How do you cause chaos in a society? How do you create total demoralization? How do you paralyze a society so they will beg for a powerful leader? How do you impose essentially Stockholm syndrome, where the hostages put the entire society under house arrest and then induce this kind of dependence and a gratitude towards your captors, where you believe that the only thing that can save you is if you obey, if you do what you're told, if you take the vaccine. And this was deliberate. If you look at the transcripts, which we have for each of these simulations, the first one was called Dark Winter, another one was called Clade, another one was called Crimson, another one was called Event 201, and on and on. And they do this again and again and again, and they were signaling exercises. People who took part in Event 201 they're taught how to basically violate the Constitution and do all these things that normally a public official wouldn't do. It's teaching them how do you shatter a democratic society. And the people who took part in those events, if you look what happened to them, they're the ones who then, as soon as COVID-19 pandemic started, they were moved into places of power. One of the members, the CIA member of Event 201, is now the head of the National Security Agency in the Biden administration and runs all the COVID-19, the top guy in COVID-19 response. Virtually all the people who participated in those training exercises, which is how do you impose authoritarian rule, are now running this country. Clearly, it was self-serving. If you look at Gates' psychology, and I try not to look into people's heads because you can't really tell what they're up to, but if you look at all of the trajectory of all the projects that he's involved in, which is he's done the same thing, this monopoly control of the food system in the world, the global food system. And he controls virtually the entire seed stock of global humanity. He was able to get in control of all the seed banks.
Yes, science! Don't forget to smash that subscribe button.
And this is just a little graphic showing the New World Order and how that it tracks on down. You can take a look at that. I do want to mention the Hegelian dialectic. That sounds pretty fancy, but basically all it is just action, response, and then synthesis, whatever you work out. You all do this all the time. You and your wife or husband decide you want to go to the movies. One of you says you want to go see movie A. The other says, no, I don't want to see that. I want to see movie B. Okay? Well, the one who wants to see movie A, that's thesis. That's his thesis or her thesis. One says, I want to see movie B, that's antithesis or antithesis, the antithesis. Okay? Now, then you work it out. If you're like me and my wife, what we usually do is end up going seeing movie C, which is second choice for both of us, but it's one we can agree on. That is synthesis. And that's how it works. And all Hegel did was simply kind of work out this formula for human interaction. But where the secret society folks took a leg up on it is they figured out you don't have to wait for a problem and then offered a solution, and then how it works out is what you get. You create a problem. You create a problem, then you offer the solution, and then whatever's worked out, you got it. When the Murrah Federal Building was bombed, they had anti-terrorist legislation pending in Congress, and some of it was pretty draconian. It was going to just shred the Constitution, and most people were going, wait a minute, I don't know. They weren't going for it, and it was hung up. It wasn't going anywhere. Boom, federal building in Oklahoma blows up. I'm not going to go into that, but most of you know there's a whole lot more there than Timothy McVeigh and his little fertilizer bomb, okay? But boom, it goes up. All right, now you got a problem. And what's the solution? Got to pass all this anti-terrorism legislation. But then that's a problem. So what's the solution? Well, you work on it, you water it down, and it still got passed. Not to the extent they originally wanted, but it got passed. And it's the same thing that we knew the communists did for years. 2 steps forward, 1 step back. 2 steps forward, 1 step back. This stuff they've rammed through over the past year, Homeland Security, Patriot Act. You hide and watch as the years drove on, unless they pump us up again with some other terrorist act, which they're liable to if we start balking at everything.
And they have made up their minds before even one paper had been published on the subject in 1984, as we discussed half an hour ago, when Reagan was to be re-elected, and Gallo and Margaret Heckler announced the cause of AIDS had been found before one single study had been published.
Good afternoon, ladies and gentlemen. First, the probable cause of AIDS has been found, a variant of a known human cancer virus. Second, not only has the agent been identified, but a new process has been developed to mass produce this virus. Thirdly, with discovery of both the virus and this new process, we now have a blood test for AIDS. With the blood test, we can identify AIDS victims with essentially 100% certainty.
The papers that had subsequently been published by Gallo were since all shown to be fraudulent, fabricated material.
And then a year later, in May of 1984, Gallo showed the absolute connection between the virus and the disease. When Bob Gallo proved that it was the etiologic agent in 1984, we had a diagnostic test approved by the FDA in 1985. So the test was developed, it was gone through the appropriate validation and approved by the FDA. That was really quick, from literally less than a year from the time that it was shown to be the virus that causes this disease.
I was driving to Mendocino in the middle of the night, and I was just cruising along in my patterns of thought. And out of that, the concept of PCR became just obvious to me. It was something I already knew how to do in my lab. It was a matter of heating and cooling a tube, you know. At that point, genetic diseases were starting to be discovered. We knew that there was an awful lot of information in every one of your cells. It was real obvious that we wanted that information. And PCR made that possible in an incredibly simple format. The Nobel Prize came 10 years after the PCR was invented. I probably was too young to really appreciate the awesomeness of it, but it was fun. They know how to put on a show.
What is it? What is it about humanity that wants to go to all the details and stuff and listen? You know, these guys like Fauci get up there and start talking. You know, he doesn't know anything really about anything, and I'd say that to his face. Nothing. The man thinks you can take a blood sample and stick it in an electron microscope, and if it's got a virus in there, you'll know it. He doesn't understand electron microscopy, and he doesn't understand medicine, and he should not be in a position like he's in. Most of those guys up there on the top are just total administrative people, and they don't know anything about what's going on the bottom. They've got a personal kind of agenda. They make up their own rules as they go. They change them when they want to, and they smugly, like Tony Fauci, does not mind going on television in front of the people that pay his salary and lie directly into the camera. You can't expect the sheep to really respect the best and the brightest. They don't know the difference, really. I mean, that's a problem. That's a main problem, actually, with science, I'd say, in this century, because science is being judged by people. Funding is being done by people who don't understand it. Okay, who do we trust? Fauci? Fauci doesn't know enough to, you know. If Fauci wants to get on television with somebody who knows a little bit about this stuff and debate him, he could easily do it, because he's been asked. And debate me on the stage in front of the student body, because I wanted somebody who was from the other side to come down there and balance because I felt like, well, these guys can listen to me, but I need to have somebody else down here.
One of the features of the transparency on your website is that you have a list of your donors, right, so that people can see where the money comes from. And you apparently were not shy about putting Jeffrey Epstein on there. How did?
And he liked attending meetings with scientists, cutting edge scientists were talking, and so I would go to meetings mostly because the scientists were there,
that you had a number of meetings with Jeffrey Epstein, who, when you met him 10 years ago, he was convicted of soliciting prostitution from minors.
You know, I had dinners with him. I regret doing that. Were a mistake. They didn't result in what he purported.
It was reported that you continued to meet with him over several years.
You know, I've said I regretted having those dinners. Well, he's dead, so you know, in general, you always have to be careful. And you know, that's.
They reported that she's being shunted between the United States, the United Kingdom, Israel, by a bunch of very, very powerful people who have a lot to lose if her story is to come out. Where is the Department of Justice? Why is this woman not in an interrogation cell? I mean, she has the most direct knowledge. We have reporting that Prince Andrew called Ghislaine Maxwell trying to get her to absolve him of his alleged sex act with Virginia Roberts, who's accusing him, who he's been photographed with, and she wouldn't do it because she knows that it's probably true.
Just for the record, you've been on his private plane.
Yes.
You've been to stay on his private island.
Yes.
You've stayed at his home in Palm Beach.
Yes.
You visited Ghislaine Maxwell's house in Belgravia in London.
Yes.
He was invited to Windsor Castle to your daughter Princess Beatrice's 18th birthday. Why would you do that?
Because I was asking Ghislaine.
But tonight isn't just about the people in front of the camera. In this room are some of the most important TV and film executives in the world, but they all have one thing in common. They're all terrified of Ronan Farrow. He's coming for you. He's coming for you. Spoiler alert, season 2 is on the way, so in the end, he obviously didn't kill himself. Just like Jeffrey Epstein. Shut up. I know he's your friend, but I don't care.
Over 100,000 fans packed shoulder to shoulder at Lollapalooza in Chicago.
The Delta variant may have health officials on edge, but you wouldn't know it from the looks of the crowds at the Lollapalooza Music Festival. And while at this point, it's not clear it'll become a super spreader event.
Vaccines are being offered on site.
Anybody who wants to get vaccinated, Johnson & Johnson and Pfizer vaccine.
But some experts are saying everyone at Lollapalooza should assume they've been exposed to the virus.
In a recent Gallup survey, Democrats did much worse than Republicans in getting the right answer to the fundamental question, what are the chances that someone who gets COVID will need to be hospitalized? The answer is between 1% and 5%. 41% of Democrats thought it was over 50%, and also have a greatly exaggerated view of the danger of COVID-2 and the mortality rate among children.
And so if you want to attack me for being overly emotional, but am I saying that I'm better than you? Yeah, I'm fucking better than you, okay? Much better than you. You are garbage. You're garbage. And you can call me a social justice warrior. You can call me whatever the fuck you want. At this point, I don't give a shit. I'd rather be a social justice warrior than a piece of fucking shit.
All of which explains why today the states with the highest share of schools that are still closed are all blue states.
I pledge allegiance to the queers.
Shouldn't liberal media have to answer for, how did your audience wind up believing such a bunch of crap about COVID? Texas lifted its COVID restrictions recently, and their infection rates went down, in part because of people getting outside to let the sun and wind do their thing. But to many liberals, that can't be right, because Texas and beach-loving Florida have Republican governors. But apparently the governor is also a voracious consumer of the scientific literature, and maybe that's why he protected his most vulnerable population, the elderly, way better than did the governor of New York. Those are just facts. I know it's irresponsible of me to say them. Look, here's what I'm saying. I don't want politics mixed in with my medical decisions.
From a year ago, Dr. Fauci said that if hospitals get any more overcrowded, they're going to have to make some very tough choices about who gets an ICU bed. That choice doesn't seem so tough to me. Vaccinated person having a heart attack? Yes, come right on in. We'll take care of you. Unvaccinated guy who gobbled horse goo? Rest in peace, Wheezy. You're
hilarious.
That's sick.
Cheering for people's deaths. So funny. Great humor.
We must increase vaccinations among the unvaccinated with new vaccination requirements. This is not about freedom or personal choice.
A rise of political extremism, white supremacy, domestic terrorism that we must confront and we will defeat.
We all want to return to the way things were before COVID-19. But there's one area where I hope we never go back: our complacency about pandemics.
You're okay. This one, real fucking ugly. Oh. You see, I take these glasses off, she looks like a regular person, doesn't she, huh? Put them back on, formaldehyde face, that's what.
Yes, science! Don't forget to smash that subscribe button.
There are no limits.
It figures it would be something like this.
We are anonymous. We are legion. United as one. Divided by zero. We do not forgive. We do not forget. Expect us.
No expression. Hide my head. I wanna drown my sorrow. No tomorrow. No tomorrow. And I find it kinda funny. I find it kinda sad. The dreams in which I'm dying are the best I ever had. I find it hard to tell you. I find it hard to take. When people run in circles, it's a very, very mad world. Mad world. Large and open. Mad